Yo, what is all of that dental calculus and dental tartar? It is truly an insane amount. And look at the size of these things. You know what? Dental tartar and dental calculus can get huge. Teeth tartar can get really big on the teeth. The person neglects these things. These are pretty huge. And you're lucky because in this video, a bit later on, I'm going to talk about the different tools that dentists, us, and dental hygienists and periodontists, which are specialists, use to help remove that dental tartar. Now, you may be wondering, well, Dr. Mo, sure, that's exciting, but why can't we just do that at home? Well, because a lot of people confuse dental plaque, teeth plaque, which is technically softer and much easier to be removed, although it can be sometimes sticky, with dental tartar. Once we get to dental tartar, this hard, very sticky dental calculus on the teeth, that requires professional cleaning and professional training for the healthcare professional to clean it. Okay, so what are these tools that we're talking about? Let's start with something called as the manual tools. Manual as in they're not necessarily functioning in an automated or in an automatic rather manner. So these are things such as the hand scalers. Actually, they're also called manual scalers because a scaler can be using some sort of device, or it can be a manual or regular hand scaler. Now, these hand scalers come with a very sharp tip that has a very particular shape. I think I'll show you in some of the visuals. And it's specifically designed to help remove the dental tartar and the dental plaque, and it's used in a manual way using certain techniques. The thing with these things is that they require really good technique to be used. They require more time. They're more time consuming. They require a healthcare professional who had specific training in using hand scalers, which I would assume a lot of dentists at least have, and most probably dental hygienists. Now, you may think, well, this is something of the past. Why are we discussing it now? You will see at the end of the video that actually there's the manual tools that are automatic tools, and there are also a hybrid approach, which is a combination of both. Mind you, although these are somewhat technique sensitive and they require a trained person, they're also very, very useful at identifying certain spots and, in my opinion, the tactile sensation, meaning we get a feel when we use them, these manual instruments, that, okay, there's a piece of dental tartar in a particular region or area. This is in relation to the manual or hand scalers. We also have something called as curettes. If you have a background in dentistry or dental hygiene, you most probably know curettes. I think there are Gracie's curettes, and if I'm not mistaken, there are also universal curettes. I don't use them very often. These are more used in relation to things such as root planning procedure. Maybe a dentist will use slightly different or simpler terminology when they offer you these treatments, but these are the technical terms for these things, for these instruments and these procedures. Previously, something called as gingival curettage was being done. Now, I'm not saying that it's not done anymore, but discussing with a lot of gum specialists, with periodontists, they tell me they do it. Some of them have almost completely ditched that procedure. I'm not saying it doesn't have indications. Please consult with your dentist. So they do more root planning and have seen improvements and more success with that. Depends on the case. Everything needs individual assessment and so forth. Let's move. Also, they're labeled with certain numbers, and every one of them has a number and so forth. So the labeling terminology and the naming with regard to the curettes is more vast and slightly more complicated in comparison with scalars. Scalars are much more simpler in design, number one, and in labeling as well. Now, automatic tools are actually far more simpler, in my opinion. They're far more simpler to be used. They're far more easy to work with, and they produce really good results. And something very important with the ultrasonic scaler that the manual or hand scalers lack, and that is cooling. Cooling using, for example, water coolant while the scaler is being used. If you ever had teeth cleaning before, which hopefully you have had one before, you will notice that the ultrasonic scaler brings so much water. Well, that's very important because this ultrasonic scaler is using a high-tech power while it's working, and also has a like kind of a powered washer that puts the coolant into the working side because we do not want to overheat the tooth. This could actually damage the tooth. Okay, so why patient right? Okay, so remember the tips of these ultrasonic scalers, they vibrate at somewhat of a high speed. I just noticed we spend more time than I originally wanted about these things, but I'll go on. Okay, so patients, of course, in general, I cannot speak for all. There are going to be exceptions, but generally speaking, people prefer to have dental cleaning using the ultrasonic tools. These automatic tools, the devices. That being said, now I'm going to expand on something called as the hybrid approach. Hybrid, like when you think about a hybrid car, right? It means like both. It can utilize both electric and it can use fuel as well. Hybrid, when it in this context, means there is a blend in between using the hand instruments, manual scalers, which in my opinion are great, by the way, to clean the dental tartar and dental calculus, and the ultrasonic scalers. Okay, both are very good tools. Each, as I said, has each one of them have its advantages and disadvantages. So it's really up to the dentist and the patient's preference, and as well depends like what does the case need. I remember when I was still a dentist in training, I guess this is story time. So I had people who were working in a construction site very close to us. Anyways, and I would offer them, of course, free treatment, not because I wanted it to be free. Just the university system was they would pay a very small fee and they would get a treatment. When I say very small fee, I mean minuscule. So we're talking about roughly €5 or what, like maybe $7 or $8. It's nothing, and you can get basically a lot of things done under professor supervision. But of course, it's dental students who are working. I was a dental student at the time. Right now, I'm graduated, and I would offer them free dental clinics because I knew these people that mostly had a very limited access or did not have really a lot of access to a dentist, because dentists can be expensive to go to anyway. So when I had worked on some of these individuals, I would notice, unfortunately, some of them may have not had a professional dental clinic for a very long period of time. And in those cases, actually very challenging to use manual scalers and the hand scalers. So I would go for a hybrid approach where I would use a manual or hand scalers as well as ultrasonic scalers. Okay, so story time is done. I showed you the dental tartar being cleaned. We talked about some of the instruments, and I gave you some story time from the good old days when I was still young in dental school. Thank you everyone for watching. Don't forget to like, subscribe, and share this with your friends. Peace.